KwaZulu-Natal is the second highest number of COVID-19 infections. A little less than 6,000 numbers were confirmed in the last 24 hours. Measures are being put in place to curb the spread of the virus. Joining me now from Durban is Head of Health Department, Dr. Sandile Shabalala. Doctor, thank you so much for joining us this evening. So, 5,924 cases reported in the last 24 hours, slightly up from yesterday. Are you concerned? And also, your preparedness. Talk to me about that, sir.
Yeah, thank you, Tony. Let me greet you and greet the viewers of your program. We are concerned with any and every new case that we get as a province, because each time we get a new case, we know that there were contacts of that case, and every case, therefore, says to us we must trace the contacts of that case and see whether they are positive or negative. So that's a concern in itself. The second reason we are concerned is that with each case, we have to check the prognosis and see whether our resources are going to be required to be spent on that case and other cases related to it. And remember, we are speaking of COVID-19 levels going up at a time of holidays, and the accidents may go up as well. So all those are concerns. At the same time, we can report that we are ready. We have been ready since the other waves that we've been going through as a province and as a country, and we have enough beds so far. If we look at the numbers of people that are admitted and the numbers of the people that are active, very few are admitted, both in the public and the private sector. So we are ready at that level. We also do have a number of human resources that we have contracted until next year, who we also are going to be using should a need arise. However, we are worried because they themselves do get to be infected. So we really are very, very much cautious. Hence, we are saying people must still go back and adhere to the non-pharmaceutical interventions. Though already we can say we still need to partner with the community.
So, Doctor, what sort of picture are you seeing? Is it the same picture that's been seen nationwide when it comes to the hospitalizations? And I want to bring us to the vaccination issue here as well, because most of the numbers coming out are saying slightly over 70% of people that are being hospitalized are those that have not been vaccinated. Is that the same that you're seeing in KZN as well?
True, that is the case. In fact, what we've even picked is that some of the people that have tested positive were actually people that had to be tested for one or other reason, not because they had symptoms. So vaccinated people have found themselves not to be having symptoms, even if they get to be infected. Vaccinated people have not needed to be admitted most of the time. Those that needed to be admitted did not need to be in high care or ICU or even in oxygen. But the unvaccinated ones are the ones that need a lot of care.
I think we've just... Doctor, I think... Okay, I think Dr. Shabalala, you're freezing a little bit there. We'll try to get you back. I think you're still there. Please carry on. You were talking about the vaccination issue, that some of the patients that have been admitted are not being admitted for COVID, specifically for COVID, but they get tested and are found to have COVID after arriving for some other procedure in hospital or something else in hospital.
Yeah, let me make another example. We recently had a conference, and during that conference, people would be checked, and when they were being checked, they were totally asymptomatic, and they would check simply because it was a requirement before you go into the conference to be checked. And we would find people to be COVID positive, asymptomatic as they are. The ones that have been admitted for whatever reason, they would be having mild symptoms if vaccinated, but the unvaccinated ones have very worse symptoms, but their prognosis also is on the worst side. So we are saying vaccination has assisted us in improving the prognosis, in improving the number of deaths. As you have said, the number of people who have been infected has been high, but that does not translate immediately to a number of people dying out of COVID-19. Hence, we are saying non-pharmaceutical interventions must go on. vaccination must go on, and we are disappointed that we are second last in terms of population or herd immunity that we want to achieve as a province. Hence, we want also to encourage people to come for vaccination because we see that it has advantages.
As you mentioned earlier on, holiday makers are going to be making their way from Gauteng. Well, I'm doing that with my family as well, coming across to KZN, so you can welcome us. Thank you very much. But so when you look at the pictures we were seeing of the Durban beachfront, I mean, it was throngs of people, albeit it is outdoors and so forth. But, you know, what measures do you have in place to sort of control it? I mean, it will be difficult, but you have to try something. What measures do you have in place at the present moment?
Look, besides encouraging people to take responsibility, our Premier and the Executive Authority generally has said that the enforcers of our province, the police and all the other related people to that cluster, must make sure that enforcement is adhered to, but also organizers of different engagements that are going to be happening are also engaged to say, when you have these engagements, make sure that your people are adhering to all the non-pharmaceutical interventions, be it in the beaches, be it in enclosed areas, wherever they are, because the best method of managing this disease is that we prevent it being infected or being passed to other people. So that is what we are doing. But should we find people being positive, we also follow up and make sure that they get the treatment that they deserve.
Doc, lastly, your hotspots, is it still eThekwini?
eThekwini is still leading, and we're worried about that. We're also worried about the fact that when people go for holidays, they will leave their other medications for other chronic diseases, and we want to urge them, do not forget your medication. Do not forget your medication at all costs. To those that will be driving and those that will be taking alcohol, do all the things that you'll be doing with great responsibility. Yes, we still welcome, yourself included, Tony, to the province, but responsibility rests on all of us so that we can save the people of our province, the people of our country, and the people of the world generally.
100%. Doctor, thank you so much for chatting with us this evening.